Assalamu alaikum, the communication today. First scenario, Mr. John. He's 35 years old with history of weight loss and candida infection. HIV test was done for him after written consent, and the result came as positive. Your task to talk with Mr. John, address the concern and the management plan.
Okay.
Okay,
Hello, my
you
name
can
is
start.
Okay. Hi, hello. My name is Dr. Maida, one of the medical doctors. Just can I confirm that you are Mr. John at 35 years old?
Yes, I am, doctor. Yes.
Hi, Mr. John. How are you today?
I'm fine, doctor.
Okay, Mr. John, we are here to discuss the result of the test we have done several weeks back, isn't it?
Okay, doctor.
Okay. Okay. Do you think that I think okay. Can you tell me how you feel now?
Actually, doctor, I recently, about 2 to 3 months back, I have some loss of weight and night fever, raising body temperature, and I'm not good, and some difficulty swallowing. So I seek advice, and they told me uh, they are thinking about HIV infection, and they told me to do the test, and I agreed for that, and I did the test. Today I came to know the result. If what is going on?
Mm-hmm. Do you have an expectation about what it may be or any specific concerns?
I'm not sure really, doctor, what happened.
Mm-hmm. Okay, so the results is now released and we have a diagnosis now. And unfortunate, the result is not as we hope. And it shows that it's positive for the HIV.
Oh, HIV. This is dangerous, doctor. This is dangerous infection.
Mm-hmm. I know this may be a lot to take in, and it is completely normal to feel shocked or overwhelmed. But I want you to know that you are not alone in this. HIV is a manageable condition now. It's an infection. Do you want to know more about it?
Yes, I wanted to know. So it is curable, doctor.
Okay, so HIV infection, it's a type of viral infection. And nowadays, previously it was one of the dangerous disease that's is not treatable, but HIV nowadays manageable. It's not completely curable, but it can be manageable, and you can even live longer life with it and with the healthy life with it as well, with the correct treatment and management plan.
So after I receive the treatment, I will not be infective to others?
Okay, I will go through this step by step. And first of all, you might have many questions about your health and these things and about the future, I know. And this is normal, and how you would be to run your relationship. I would answer all these questions simply regarding the relationship. Mainly, I mean, with sexual relationship. Do you married or?
Yes, I'm married and I have 2 kids. And I wanted to tell you that please don't tell my wife, because if she knows, she will leave me.
Mm-hmm. Okay, I highly appreciate your concern, and I prefer that you tell her about the disease, and if you need some support, from our side to tell her as well. We can provide you with the support
No,
to.
no, 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 doctor. No, doctor. I will not tell her because I'm sure she will leave me. If I don't, if I will not tell her, you will tell her.
Um, in fact, because this is infectious disease, and we prefer that she need to know about it because this as well infected one, and she may have the disease as well, and she may need to take the medication as yourself if she is infected, and our role as doctor to protect her and protect you as well, and even your kids. So it's better to let her know about the disease either
I
by
will not tell
yourself.
her. Sorry, doctor. I will not tell her because I am sure she will leave me. But I ask you, you will break my confidentiality and you will tell her.
Mhm. So there is some disease. One of them is the HIV itself. We call, and it's a notifiable disease. And in this case, the confidentiality of the patient, generally we generally keep the confidentiality of the patients, but in some diseases still we need to notify about it because it's not affecting you alone. It affects your partner as well, and she have the right to have the treatment as yourself. I can understand your worries, and I'm afraid if she knows about this disease from someone else, not yourself, she may get more angry, and she may lose the trust in you. How this sound to you? Are you
I
following?
wanted to, doctor, I see my wife, she has good health. No
Mhm.
weight loss, no rise of body temperature. So possibly she is not infected with this virus.
I'm afraid we are not 100% sure about the that she's not infected because this disease, in fact, to some people can live with well health for a while with that disease in the especially during the first stage of the disease. So we cannot guarantee that she didn't have the infection. In order to make sure that we need to investigate her, and it will be good for her and good to your family as well as whole.
Doctor, can you do the test for her without telling her? I will bring my wife to the hospital and we will take blood sample and I will this for lipid profile, for hemoglobin, for and from it you can do the test for her to know if it is infected or no.
Mm-hmm. I know there is. I can understand your fear, but as doctors, this is not usually what we'll do. We because we have a relation with our patient, and the main issue is the trust between the doctor and the patient, and we can't do something again. We can't do something without someone consent.
2 minutes left.
Doctor, if now if now for the intimate relationship with my wife nowadays, how I can manage for this issue now?
Okay.
After I can become positive, and we don't know if she is positive or negative according to you.
Yeah, this is very good question. I think if you can use the complete protection, protective sex like condom, and this
How-
will be very helpful nowadays.
So condom is protective 100%, doctor.
Yeah, it have a high protection, so it will be good idea if you can use that. And we also in this meeting, I think there is a lot of things still we need to talk about the management plan and about how you
No, no,
how you can.
doctor.
Mhm.
Sorry, doctor. I wanted to tell you,
Uh-huh.
I do this casual relationship many
I
times
couldn't hear you.
before for years. Sorry, doctor. I now you hear me?
Yes,
Hello?
yes, I can hear
Um,
you.
I wanted to tell you I do this casual relationship for many years before, and I don't know when I get the infection actually. So I do the intimate relationship with my wife for years now. So possibly she is infected or uh, or
Yeah. As I told you, we are not quite sure at the moment that she's infected, and this is a big possibility that she had
is there any
infection.
possibility she is negative after all this time of
Uh,
intimate relationship with my wife? Is still possible? Is there any possibility she is now free from HIV after all the
Unlikely.
time? Mhm.
Time finished. Unlikely to be free from infection with this long relationship.
What,
And
what about my kids now, doctor? I one time I go to bathroom, I found my son take my uh, brush my tooth and he use it. My equipment is he was playing with it. Is there any possibility my kids get infection from me?
mhm,
And I usually take my son in between my hands and I kissing for him.
mm,
Is it possibility?
mhm. Sorry. Okay.
Is there any possibility my kids to be infected from me?
For the HIV, normally it's goes through the bloods and close contact, like saliva. I mean, from saliva and the things it can be, but from the mouth brush, unlikely because it needs an active relation and very close relation. It's not it cannot be.
Okay, doctor, I read in a website the name as post-exposure prophylaxis. Uh, eh, I can give this to my kids and my wife. It can protect them.
As I told you, first we need to know exactly if they are infected or not. Regarding your kids, if there is infection, most probably this can happen when through the childbirth time, because we don't know exactly when you had this infection.
You
And
know, doctor, my wife is pregnant nowadays. You know, she is pregnant nowadays.
mhm. Okay, I think this.
This is the last concern, okay? Continue, Dr.
خلاص خلاص كفاية. Okay.
Okay. Regarding pregnancy, we need to discuss this with the woman doctor as well. That's it's very important for her to know that she may have caught this infection, and most probably she caught it in order to protect the baby and to find the way of the birth, the protective birth for that baby to not get a lot of infection to get the infection from his mother. So we need to discuss this with the woman doctor. I'm afraid I can't give a full details about this because I am not informed about all the information. But I will discuss this with my consultant and with the woman doctor, so they can help us in the way an infectious disease as well. So they can help us in to find a good way to manage this point. Does that sound good to you?
Okay, doctor. Thank you, doctor. Thank you, doctor. Thank you.
It sounds no concerns. Dr. Mahi full of concerns today.
كله كونسيرت.
Yeah.
Yes.
ولا
Okay.
آخر.
Well done, Dr. Maida. Let's hear Dr. Mahi comments, please.
انت اعمل انت الكومنت صراحة. دكتور باسم you can comment.
No, because you prepare
لا ما
every
احنا
comment
عايزين ان
concern.
الاجابات بتاعت الكونسيرنز
Yes, exactly. So I will comment after that, but I need from every concern what the answer, what you read, and I will comment. If you don't have, I will comment, no problem.
Okay. For the first concern about HIV itself, it is curable or no? The answer is no, it is not curable, but only we can control.
Manageable.
Yes, we can be. There is yes medication and the new generations of medication and that, but it is not curable at all. Yani not 100% curable. Okay, so we can manage it only. You agree for this answer, Dr. Bassem?
Yeah, it is manageable. I told him, I told the
Mm.
patient
Yes,
that
I
it is
prefer to say
manageable, not
manageable.
curable.
Yes, I agree with this. Manageable, although it's maybe near normal life means maybe totally curable, but we don't know how status he's diagnosed now, how much the CD4 count. So let's say it's
Yes. Okay.
far
Second.
until further investigation.
Yeah, second concern, I told Dr. Ahmed, my wife looks good and no weight loss, blah, blah. So possibly she don't have the HIV, and she answers this concern good, that there is a long time before patient becomes seroconversion. So until now, we cannot say she is positive, and we cannot say she is not negative, and we should do the test for her as early as possible.
Exactly. Yes.
Okay.
Non necessary or unnecessary. If she's healthy now, she doesn't carry the virus. She might have the virus, but her immunity is okay and no
Totally.
manifestation. Perfect.
Yeah.
The next concern.
I told her now how I can manage now for the intimate relationship with my wife, and she said condom is protective 100%. But this is not right. We cannot guarantee for the condom and for these measures to protect 100%. And because there is a shortage of time, I can say if I use condom now and these measures, my wife, she will ask me why. Will you a long time do this relationship without any problem? Why now you use this? At that time, she me ask,
So
يعني,
you need
should
to
I
tell
tell
her.
her? She become, but I did not ask this concern for her. The most important concern in this, I don't want, I will not tell my wife because if I told her, she will leave me. And Dr. Mayeda insists that you are the one who will inform her, but I will tell directly for the patient. If you will not tell your wife, I will break your confidentiality and I will tell her. Okay, because this is يعني infective disease and she can يعني send me to the jail, me and you. Okay, so I will tell her it is better for you. You are the one who tell her. This will increase the trust between you and her. But if you insisted to not inform your wife, we will tell her because this is a legal issue. Okay.
Yes,
Okay.
yeah, it is notifiable disease. She need to know. I told you like that. But to not increase the conflict with the patient, we keep saying
Mhm.
the
But
one,
if
the ones
because
who.
there's short time, yes, it is only 10 minutes, and we should give clear answer
Yeah, I
that
told him that it is notifiable disease, and she will know. We will let her know about it. But it's better to tell her by yourself, and we will help you to break in this news for her. Just
yes,
it's a way around it.
Yes,
I
I
tell
agree with
husband,
this.
I tell him that I will tell the patient, but in a nice way, you can say, not like
Yes,
conflict with the patient.
exactly. Yeah, this is the point. She should know first of all. She should know. The second thing, if he insists, he will be the one encouraged to be informed. If he's still not convinced, we can have a consultant. Sorry, we can have a meeting with our team. They can have a meeting with your wife to tell her in small and sorry, it's not small, in a gentle way without harming her. Okay, this is the second option. So co-meeting, it's called co-meeting. Here, the husband and the wife and our team. This is also by notifiable the infection control team. By the way, it's not notifiable disease anymore, Dr. Maida. You know that, right?
No.
Yeah, it's not notifiable. HIV, not notifiable disease anymore.
So the answer again for this question, if
Yeah, she should know.
insists, if he insists.
If he insists not to inform, we can, the second option, meeting with her, with you, to give the message to her in good way. If she insists, no, if he insists, sorry, not to inform, sorry, we have to inform. And if you will not inform, we can message her with anonymous clinic or message that someone infected with HIV and you should do the test. If he's still insisting, the last option, sorry, to breach that confidentiality, we have to inform her in the sake of her health and your family health. So we are legally bound to inform your wife about the condition or about the test. This is the steps, or these are the steps. Okay. Go ahead, Dr. Mohi. Any other comment you want?
Mr. Basim, it is not
Yes.
notifiable, and there is
Yes,
no
it
need,
is not notifiable.
and there is no need for consent to check for HIV as well.
Yes, exactly.
Yeah.
No need for written consent, but it was written in the scenario, so I will not talk about this. I will just do the scenario, but it's not a need to be consented as written consent.
مكتوب عندي scenario it should be written consent.
But I agree, Dr. Mohi. But if
old يعني old fashion this scenario.
Maybe old, this is the first thing. Maybe also okay, done as written consent. We will not argue with this. But if the task to get a consent, and the next time, I mean, don't say we have to sign a consent, written consent. We can say we have to take verbal consent from you that we will do the test. It's not written consent anymore. This is regarding it. Dr. Maida, I will comment about the introduction. I prefer to say initially this meeting is confidential, and it's a sensitive information. We have to assure the patient about the confidentiality. I prefer to mention it earlier. And the good thing here, you didn't invite someone to attend this meeting because it's a very sensitive point to be mentioned, right? Agree?
Yes, it's completely agree. First, I was about to say, then I stopped. Yeah, because this confidential.
Perfect. Yeah, I felt like you are hesitant to say that, but hopefully you didn't say it. What else? The other comment. So starting from the first comment, don't inform my wife. We already addressed it. The second comment, she is pregnant. We want to do something for her and the baby. As Dr. Maida said, don't worry, we can involve our woman doctor. She can have a meeting with us to take care of the baby and the wife. The last concern, or the third consent, the third concern, sorry, about again the relationships. Can I use the condom or not, or 100%? Nothing is 100% sure. You can hear me?
Yes.
Yeah, no 100% protection as per condom, as protected. It might be still have a risk to be transmitted, as you said, Dr. Mahi. And I prefer not to mention numbers. As Dr. Mayada said, no, it's 100% protected. No, you don't know what the circumstances there. She might have the virus either from the relationships. It's not only by the relationships, even with the saliva contact, it might be there, right? So no protection, no 100% protection.
So the question of toothbrush of the sun.
Yes, I believe it's one of the methods of the methods. So it might be the reason of infection.
But
Yeah.
the saliva, unless it's active, because HIV is
Again, so we will go back to the
virus.
viral load. You don't know.
It's not the viral load. That's the toothbrush is out of your body, out of the body.
You don't know how much the viral load of the father. So it might be transmitted through the saliva again. You don't know also, is it clean or not. So don't assume it will not be infected. It could be, even if low percentage, but don't give 100% again percent that it's not
There is no
infective.
just this is not the way. This is not the normal way the viral is transmitted.
So
This is not the way.
so why they are saying please use, don't share your private tools and instruments? Why? One of them, they I think the brush tooth. I think so. A toothbrush, right? One of them, I think, toothbrush. It's one of the private tools. I believe it's one of the methods of transmission of the virus, even if
ممكن
low
نجاوب
percentage.
ممكن نجاوب
Sorry?
إجابة دبلوماسية ممكن نجاوب إجابة دبلوماسية في الموضوع ده
Yes,
إنه
go ahead.
لا مثلا يعني نحن نقول
In
إنه
English, yes.
yes, less likely for the
Exactly.
toothbrush
Yes.
to be infective, but
Yes.
better to be avoidable.
Exactly.
And
Exactly. I agree.
and screening for the يعني kids for him, it is needed or also or no or only wife.
Everyone.
Screen
Everyone.
even to the kids. I feel like even him. This may take
Everyone.
his wife already have the viral while she is pregnant with them, maybe. So we don't know for how long. That's why I need to do for these kids as well.
Exactly. Everyone in the family should be screened. You don't know what the situation there. You don't know what the circumstances, how much they are sharing these tools. Particularly the wife, she is the most susceptible to have this virus in her blood. We will screen all of them, and from now onward, you have to use protected sex. This is the way how to address the HIV as screening and in the same time precautions.
I bring this paper from UK website
Perfect.
of
Go ahead,
sexual
Dr.
health.
Go ahead, Dr. Ansh.
HIV can be passed by sharing toothbrushes with someone who is HIV positive, as once outside the body, HIV has a very short life and would be weakened by exposure to air and water. So practicing
So it's not, or it is? It is not?
not.
Not. It's not, right?
Mm.
Okay. But if we talk in diplomatic way, as Dr. Muhi said, yes, it is less likely, but better to avoid. Why not? Why not to avoid it? Okay. Anything he's using nowadays should be for him only. I believe this is the best way to address, and don't go false hope. Okay. If we say, for example, if you assume it's not transmitted by the toothbrush, and by any way his son came back
Because this advice, Dr. Bassem, about personal things, it is in contact precautions that we give advice about. So better not to advise about these things. Yeah.
not to,
I think, yeah.
not to advise.
Personal, yes, not to advise.
So what will advise?
Because this is for contact precaution only. If the patient has droplet infection like that, this is the advice we give.
No. HIV by any secretion, any body secretion, the tears, the saliva, the semen. I think this is what we know, right?
Yes, but not with direct contact.
Maybe indirect. Yes, as Dr. Maida said, as a direct contact. So the toothbrush is not direct contact, so it might be dry by air. Anyway, not to be in debate, better to avoid the private tools.
دكتور بس كان في كونسيرن انا رفعته برضو انه
Yes,
ان هي يعني my wife is good and health
it's not necessary.
so is it, maybe it is not infected فدكتور
No,
ميادة
not necessary.
I share
No, not necessary.
so يعني
Again, immunity, it depends on the immunity. Some patient or so, and the viral load itself. It depends on both viral load and the immunity. If the wife immunity is good and the viral load in her blood is low, so she will not be manifested by any of the signs or symptoms of the disease.
no
If the
I mean
opposite,
from this yes I mean from this concern انه semen is infective يعني it can be infective to the wife like this yeah?
yes, of course.
Like
any body secretion,
like saliva secretion like saliva or
any
can be
body
infective.
secretion will be infective. This
Not
is,
only blood yeah. Any safe
Anybody?
condition.
Yes.
Okay. Last concern I raised,
Yes.
it was post-exposure prophylaxis. What's this, doctor?
Yes. How do you know? Is it did she get the virus now or before? To give this PEP, it's paper called PEP, right? PEP, post-exposure prophylaxis. But how do you have a guarantee that she had the virus now? I mean the kids or the wife. Maybe since before. We have to do the test. Unless there is recent contact yesterday, for example, relationship.
بس هو
Yeah.
هو
This
البوست
is the,
exposure prophylaxis exposure prophylaxis, this medication given to the patient before we know he is become infected or no. Okay, is that right or so? Post
no,
exposure prophylaxis.
after, for example, needle stick or after sexual contact with someone who's highly susceptible to be HIV. This is the idea of this
An
exposure.
example, you know a scenario of the nurse who stick injury from needle was patient with HIV. We not yet finished the test for her, but we start immediately post-exposure prophylaxis for 28 days. So even before we know the patient is infected or no,
Yes,
we
because
start
there is
this.
event. There is event, which is HIV needle stick. But if you don't have an event, how you can judge there is recent contact?
This is يعني to be in one house with يعني person infected.
No,
So
but this
when was
patient
the
may be
contact? Yeah,
infected.
go ahead, Dr. Mia.
The wife and the kids, this is not event. This
Uh,
cannot be.
Yeah, it's the event, but the question is that she, for the nurse, that we have no exact like she has a needle and we don't know if she will get infected or no. That's why we give her prophylaxis. But for this lady, she may infected. The possibility of having infection and she need treatment, not prophylaxis, is higher. That's why we need to examine her to see if she is infected, because there is a high possibility that she is infected and need treatment, not prophylaxis. You get me?
Yes.
Dr. Mohammed, we have to have an event to judge on. You cannot assume that the baby or the kids have the contact yesterday, or because the prophylaxis means within 72 hours. After 2
Yes.
hours or within 72 hours. So how you are judging on this?
Okay. Yes. Okay.
Any doubt or suggestion?
No, sir. Thank you, sir.
I found, Dr. Bassem, that it's not transferred by secretions, HIV. It is just, are you with me?
Yes, I'll tell you. So what is the mode of transmission? Needle stick
Just
and
blood
okay.
and intercourse, because there is some injuries like that, so unprotected. Yes, not from secretions.
So the semen is not secretion?
Not in secretion.
So kids now possibly not infected.
Sorry, Dr. Mahi, what you said?
Kids now safe, safe for kids now. No need
This
to
is
do
from NHS, Dr. Aisha?
no need to do the test for the kids.
Yes, I share the picture.
Okay.
The kids are still I will do it for them because we don't know, maybe at birth. I will do the test because I am thinking about the birth. At birth, maybe they have the infection with the infected mother, not because
during
of the
delivery.
breast things.
During delivery, yes, Dr.
Yeah,
Maya.
not the breast things. No, I will
Not
do
from
the test because I'm thinking that they had the
from
infection from their mother.
From their mother, yes, not from the father.
Not the infected brush things.
So the only way is the semen, Dr. Aisha, you mean? No kissing, no nothing through kissing.
But we did a lot of HIV scenarios. We didn't mention any kids or family member or something. Just the direct sexual, I think.
No, we only usually advising regarding the privacy of the tools.
Yes, but
Maintain
we
their privacy.
didn't advise about to check the family members or kids or someone living with you. So I think we should not ask for kids.
I think we have to do this.
I really I think, Dr. I get you. I get you, Dr. Aisha. It's not like tuberculosis or something like that, the family member. But it's not about the family member. It's about close contact with blood. Because these kids, we don't know exactly when we in the scenario. We don't know exactly when this father has HIV. He may had this HIV and his wife has HIV before they have the kids. So the kids may be infected during the birth. That's why we need to do it. We have no duration. We have no duration of the symptoms.
Yeah, I agree with Dr. Laida.
Protection.
We have to do it. It's a necessary one. Sorry, Dr. Aisha? You can hear me? Dr. Aisha. Okay, you can hear me all? Hello?
Yes, yes,
Okay,
yes,
let's start second scenario, Dr. Mahi. Sorry, Dr. Aisha, your scenario. Dr. Maida. Yeah, Dr. Marwa asked how to reply concern of post-exposure medication. As we mentioned, it would be for the person who have recently contact with HIV patient or highly suspicious of HIV patient, like needle stick or sexual contact with HIV patient. So we have to start the PEP, post-exposure prophylaxis, within 72 hours, as soon as possible, okay? This is a way how to address this issue because it comes in the basis exam.
ممكن تقولها تاني يا باشا بعد اذنك؟ قولها تاني كده ما سمعتهاش
Yeah, to
كويس.
start the PEP medication, post-exposure prophylaxis, within 72 hours of the event, either needle stick or sexual contact.
مم. اوكي هو كان في كونسيرن تاني بس ما لحقتش ارفعه.
Raise it,
اللي هو
let's learn.
screening for the يعني women who do sexual a casual relationship with them يعني
Yeah,
كان
what do you think?
I don't know really. I don't know the
So we can send them anonymous message to be also notified and to send them to the clinic to do the test as anonymous contact with someone having the disease. This is the way as well.
يعني
So
anonymous.
you didn't breach the confidentiality of those people. And at the same time, you tell them that they have contact with HIV patient.
ما in general كده.
Yes.
So message by mobile يعني ولا
Yes,
بتقول إيه؟
anonymous message by
اسمها
mobile. Anonymous,
اسمها
yes. Anonymous means unknown from the clinic as they have contact with unknown patient, which he has HIV. Okay. Unknown. I will pronounce it I will write it in the chat box.
اكتب ماشي باش اكتب.
Okay. Okay, Dr. Maida, your scenario for Dr. Mahi.
I've sent in the group.
Okay. Mr. Adam Fox, 32 years, has 2 months history of bloody diarrhea. A colonoscopy was performed and the biopsy result have confirmed a diagnosis of ulcerative colitis. Your task is to discuss the tissue, discuss these findings with the patient, explain the nature of the disease, and the management plan, address any concern he may have. I will share it to the chat box here, Dr. Mahi. Then we can start after 2 minutes. Any doubts about the HIV scenario? TB is notifiable, but HIV is not notifiable anymore. Okay, ready, Dr. Mahi?
Okay.
Yes. Here you go.
Hello, good morning.
Good morning.
I'm Dr. Ismail, Senior House Officer of on duty now. Am I talking to Mr. Adam? And you are 32 years old?
Yes, doctor.
Welcome, Mr. Adam.
Hi.
Today we will discuss your health issue and I will address your concern. Is that okay with you?
Yes, it's okay.
Do you want any one of your family member or any friend to attend this meeting for support?
No, I'm okay.
Okay, Mr. May I ask you initially, how much do you know about your health condition?
Yes, doctor, I have this problem with this loose stool and blood, and it's really annoying me over the past 2 months. So I did the camera test, and they said that it took some snips from there, and I'm here to have the results of the snip.
Mm. And what about your expectation regarding this result of camera test?
Okay, doctor, I'm really afraid and I'm concerned that I may have a cancer, as my father died of a cancer at the age of in his 60s.
Mm. I'm sorry for your father, Mr. Adam, and I assure you that it is not a cancer, but it is not also as we hope.
What do you mean, doctor?
You have a disease named as ulcerative colitis.
Mhm.
Have you ever heard about it?
Never.
This disease is related to defense system, in which this defense system has defect in it should attack the bug infection. In your case, it attacks the body itself. It attacks the gut or your bowel. So it gives these symptoms in the form of blood loose motion and this tummy pain and these symptoms you suffer from. Okay?
Mhm.
This disease is long term. And it is, I'm sorry to tell you, Mr. Adam, it is not curable disease. And we advise for all those patients who suffer this disease to be under need follow-up regularly with the gut doctor and to be adherent to the medication. And this patient will be for life on medication.
Okay, so doctor, it's not treatable. That means I will be on and off in the hospital with these loose stools and diarrhea and blood.
Actually, Mr. Adam, this disease is variable. Sometimes it is severe with some persons, and some persons know it is mild disease. So there is grades of the severity for the disease, and until now we don't know because this is recently diagnosed for you. It is severe with you or moderate or mild disease. But we will keep you under follow-up and we'll start for you medication. As long as you are adherent to the medication, so less likely to be get frequently admitted to the hospital and receive medication. Are you following me?
Yes, yes, doctor.
I'm sorry to tell you, Mr. Adam, this disease sometimes it becomes severe and need not only medications and injections in the blood channel. Sometimes we consult the surgical team and they interfere. So this patient, disease, as I told you, it is long-term disease, and we don't know the nature of this disease with you. So we will give you medications, and we want you to be more adherent with this medication. The types of this medication is steroid. Have you ever heard about steroid medication?
No.
This medication, it attack the defense system and decrease its response to attack the gut. But it has some side effects, such as thinning of the bone, some soreness in your stomach, raising of your blood pressure, raising of your blood sugar, and also it decreases the defense system itself. So we will give you medications to protect your body against the side effects from the steroid, such as some tonics, some vitamins, protection to your stomach, protection to your bone, and we will keep you follow up to check the blood pressure and the blood sugar. If any rise of them at that time, we can give you medication. Also, sometimes it causes weight gain. So we will keep you to some modifications, the lifestyle and going to the gym like this. Okay?
It's not okay, doctor. You are giving me medication to cause a disease, and you said before that it's affecting the immune system and my disease itself regarding immune system. I'm all over. I can't understand what's going on here.
Mhm. Yes, we will give you this medication to treat this ulcerative colitis, as I told you. But all medications have some side effects, so we will give you medication to protect you from these side effects. How does this sound for you?
Boswell, in fact. Okay.
I'm sorry for that, Mr. Adam, but this is the plan of management for this disease. I wanted to tell you also, Mr. Adam, for this disease, sometimes this defense system disease, it can be associated with other diseases in the form of sometimes maybe the yellowish discoloration of your eyes. So maybe you become more pale and like this. So if you found any of these symptoms, you should contact us also for screening for this disease. How does this sound for with you?
It's scary.
I'm sorry for that, Mr. Adam, but I wanted to give you more idea about your the disease, and I will give you also some brochures and some websites to read about this because we want you to take more information about this disease because education and counseling about this disease, it will be more beneficial for you and you will share with us in the management plan.
2 minutes
Okay,
left.
okay, Mr. Adam?
Yes, okay.
I wanted to ask you, Mr. Adam, what do you do for living?
I am chef.
How much these symptoms affect your daily activity and your job?
You know, doctor, they even stopped me from working. I stopped the head chef because I have diarrhea.
Yes, yes. I can imagine how much is this horrible news for you. And don't worry. And I assure you that we are caring you and we'll keep you under follow up and we try our best to make your life as much as to near to the normal life. And I will involve the occupational health worker also for help, and we can give you sick leave regarding this issue. Okay?
Okay.
Do you smoke, Mr. Adam?
No,
Okay. Do you drink alcohol?
no.
Okay. What is your concern, Mr. Adam?
No, doctor. Okay, thank you.
Okay.
Concerned.
Okay, Mr. Adam. I will give you the hospital contact number also for any query, any question, any help. We can give you this help. Okay.
Okay.
Okay, Mr. And right now we will start the medication for you now, and I will do the what name as multidisciplinary team, including a gut doctor and the occupational health worker and social worker and the specialized nurse. And we will keep you under follow up and we'll start the medication immediately. Okay.
Okay.
Perfect, Dr. Mahmoud. Really perfect. But if you add at the moment, at the last moment, are you agree to take the medication? It would be like the full mark concern or question.
Yeah. Okay.
Otherwise, you did great, Dr. Maida will comment now.
I think you did very well. Very well. The only thing that I think this disease is it's not the best way to address this scenario as breaking bad news. It's not a type of scenario that you need to address. You need to tell the patient about the diagnosis, but not as bad news. It's not it's a bad news, but not the way of the bad news. I will let you know how. That this patient is suspecting something more serious now. He's suspecting cancer. And I totally agree that it's a chronic disease. However, it can be manageable and the patient even have a normal life with the medication still. So always we are giving the news and we give hope. You go through a lot of things, the complication of this disease. And, however, I preferred in this case to tell the patient that people react differently from one person to other, and we don't know how your body will respond to this disease, and however will keep you under our eyes, so we'll know exactly when, if there is anything happened, and we'll keep you updated. So I will not discuss with this patient who I'm shocking him that he has a new disease, chronic disease. It will be with him whole life. And then I tell him about the possibilities, the bad possibilities of the disease, which is extremities and can happen in some people and not in others. So I prefer to give this information for other meetings when it's happened, because this patient anyway will be on follow-up with a ulcerative colitis nurse, and she will be with him in the community whole the life. I'll prefer to tell him about the treatment, that the option of the treatment, it's not just the hydrocortisone. The hydrocortisone, it will be during the attack, during the active, when there is a active phase of the disease, and when the disease in a remission, to keep this disease in a remission phase, we use another medication like infliximab and the other modalities. Like I hope if you mention that to the patient, and
Yes, I am about to tell.
and advise the patient about dietary involvement, and you tell him when he had the frequency increase, when he to come to the hospital and these things. The good thing that you touch the side effect of the hydrocortisone. However, also, I will touch very, very briefly. I will not give details at the moment. I will tell the examiner that I will tell the patient that we'll start the medication called hydrocortisone, and it acts in a way that to decrease this immunity, because your disease mainly. So I feel confused. In really, not as a patient. You said that the disease is affecting immunity, and I will give you medication to the immunity, something else. So I feel like confused at this point. Just to tell the patient that it's the immunity act against your body, and we decrease this immunity with this medication. So it should be a little simple, or make sense. Then the side effect, it's have any medication have side effects. When we start this medication, you give like briefly, it can cause high blood pressure, whatever. However, we'll give something to that. It's good that you mention all this information to the patient, but I think it's a lot to get in a one consultation, the first consultation that you are talking to the patient. It's what I'm trying to say, that the communication, it's not about how far you know about things. It's how far you manage to deal with your patient in real life. You get my point? So it's about, in real life, how you will manage this patient. You will offer another meeting, you'll offer meet MDT with a lot of people, like with gastro people, nurse. You'll involve a lot of people to help him. You tell him about group therapy for that one, something like that. But generally, I'm just telling, but you did very well.
I agree, Dr. Mayada, wallahi, with all you said to me. But I wanted to, some opinion, you say, if you don't shock the patient by the importance of this disease and the risk of, if you're not adherent to the medication,
Yes.
and he
You lose,
may, you
lose
may
the
lose the
compliance.
patient. You may lose the
Compliance
patient.
can be if you tell him that it's have two phase, remission and active phase. This is when you have this blood diarrhea and everything. And the only way to make sure that you are out of this bad time of your life is to be adherent to your medication. So it's about telling him that adherent to the medication is very important. You are telling him that, but in a smooth way. You don't need to know it. You will spend your whole life in the hospital. This is will happen. I'm sorry, it will be bail. I'm sorry, it will be a lot of for him. This is a lot of shock to a
You
patient.
you give him
Exactly.
the shock and the severity,
And you
severe
give the
disease.
shock and complete shocking.
And yes, and then reassure him that we give you a follow-up. We will keep you regularly to our OPD clinic, and we'll give you the medication. And
Yeah.
if you adherent to the medication, less likely for all these complications to come to you. I'm not
Okay.
sure.
Mhm.
Okay. For me, I agree to mention it, and as Dr. Muhi said, I believe all long-standing disease should be breaked as break bad news. This is my approach, and this is my opinion. Maybe the only way and the only situation you can talk about ulcerative colitis as not as breaking bad news because it is curable one from the point of colectomy, right? So it might be cured, but as Dr. Muhi said, to make the patient adherent, compliant, and following the instruction, the advices, you should give him shocking news. Even it's after that you can reassure him, but initially he should know it as a breaking bad news. This is my favorite and preferred way to break this news. Any long-standing disease should be breaked as in this way. Why? Because this patient frequently he will come to the hospital, frequently will come to the clinic as follow-up. He might have a flare, and the flares might affect the general condition as dehydration, a lot of blood loss. He might receive blood transfusion. So it's not something easy to be given as good news or not a bad news.
It's not. You will not give like good news, and
Yeah,
at the same time, not that bad news. I prefer it. I will do it.
midway.
I will do. Yeah, I will do it midway. That's what I explore first. I explore the patient.
Mm.
So, what he think? He think the cancer. Okay. Uh, the
So
invest-
we have to listen to a
yeah,
third
the patient.
opinion.
Yes.
Third opinion. Okay.
Okay.
Anyone has
It's not
suggestion?
about opinions. It's about okay. Third opinion.
It's a discussion, Dr. Maida. I
No, no, I feel
sometimes,
like
by the way, in the exam, you might have an examiner. He will accept it as breaking bad news. Another examiner, maybe he will comment he made breaking bad news. So you don't have any guarantee. It would be
yeah.
100% correct if you do it in this way, or 100% if you do in another way. So it's dependable on this examiner itself and or the examiner himself and the scenario itself. Anyway, anyone has suggestion we can share with us any experience
The
in
problem, Dr. Bassam, that this new format of faces, they have trend that considering any non-measurable disease that not a bad news. So if they need you to explain a disease, because any disease can be having a dangerous complication, even hyperthyroidism. So they not if they bring a scenario for explaining a disease, they didn't want you to making it as breaking bad news. In breaking bad news, it is direct scenario. It is breaking bad news, cancer, end of life care,
okay.
and palliative care. So now
Okay.
I heard that a lot of mentors mention that if a disease can be controlled and if it is not like at the end, even HIV,
Okay.
don't break it as the bad news. You can making like any way to making it like don't shock the patient directly. You
Okay.
will say what expectation we have because she is already worried. She has the colonoscopy or endoscopy. She's suffering for a long time. She
Mhm.
expected that she has something wrong.
Okay.
You
يا
can say
دكتورة
sorry if she feel worried. You can reassure her if she worried. You can mention the complication if she refused the medication. But I don't know, يعني for this
Okay.
ulcerative colitis or even what others.
hyperthyroidism.
كيف يا دكتور عائشة حتى
Yes,
تقوليها للعيان؟ قولي كيف هتقوليها للعيان؟ يعني بلاش، مش هنعملها كبريك باد نيوز. I wanted
Yes.
to
You have a
she
condition
said I
called ulcerative
expect that
colitis.
I have a cancer. Yes. Really, no, you don't have a cancer, but we have something concerning that you have already some disease we discovered. I'll explain to you. You have disease like that. Yes. And you explain like
No need for
hyperthyroidism,
No warning
like
shot. Yes.
like
No warning
patient
shot.
with
and no-
hyperthyroidism, like patient with cardiomyopathy, like patient. If the patient
Yes.
not near term or palliative care, you should not express it as I
Breaking bad news.
understand from the mentors these last days.
Okay.
Yeah.
Okay, I agree with Dr. Aisha somehow. So you can narrow the situations of breaking bad news to something terminating the life, like cancer, and not all cancer as well. Some particular cancer which have poor prognosis, advanced cancer, and palliative therapy, coma due to ICH, massive stroke. These things which are having poor prognosis, you can do it as breaking bad news. Any disease, do it not in breaking bad news typically, but you can do it in one shot. I'm so sorry, you have a condition called ulcerative colitis. Have you ever heard about it? Then explain it. So no need to make the golden silence and the warning shot. Just deliver the information and go ahead with the explanation.
Because it maybe also scare the patient. As Dr. Maheta said to him, "Oh my God, what I'll be on."
Yeah.
Because
So let's
he
narrow
like
it.
making narrow it. Be sorry and empathy and sympathy. If she
Exactly.
shocked, even patient can be shocked from anything. Maybe the patient shocked from anything. Need you to take medication for life, even diabetes. So in clinic, even if we deliver someone who have diabetes, he will be shocked, and he needs sympathy. And this didn't require to be a bad
Diabetes,
news.
Dr. Aisha, about diabetes, what do you think? Is it also one of the breaking bad news scenarios?
No, 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 no. You will make him already. He will bothered about the news. So if you deliver it as a bad news, you will scare him more. It's treatable. We can treat it. And the patient have diabetes, even type 1, maybe living 40 years without any complication if he is compliant.
Yes, yes, you're right.
I know a lot of patients now like that, no any complication.
Okay. So again, as Dr. Aisha said, let's narrow it to something very serious or something advanced and having poor prognosis. And hopefully from now onward to do it in this way. No need for golden silence nor the warning shot. Just say it and explain it immediately. So you will not warn him. He will not be shocked. He will not be scared about or scared of the disease. Okay.
Okay.
But
This
I
is the
think
take.
if the disease disabled, like motor neuron, like multiple
No.
sclerosis,
This
like
disease should be
it
yes.
is, yes.
And
If
I
it
said
lead to
yeah.
this, yes.
Exactly. Any disease having poor prognosis and progressive course, like motor neuron disease, like multiple sclerosis, like also some
Dementia.
also neurological what?
Dementia.
Myotonia dystrophica.
Yeah.
Myotonia dystrophica, yes.
Parkinsonism, yes.
Yeah. So any
Parkinsonism,
disease having progressive course, not only.
and we can't control even
Oh,
with maximum medication, yes.
okay. Okay.
Yes.
Okay.
معقولة يا
Good.
جماعة؟
Dr.
معقولة أنا
P,
IC.
you
Okay.
asked me about how you can say it like in this type of scenarios. I will give you just simple examples so you can know that you deliver the news, you be empathy at the same time, but not enter the pathway of bad news, breaking bad news. Like I will say, like, let's go over the patient. Now we are going through his results here. So I will say, like, let's go over your results together. Before I do so, can you tell me what you have been thinking or worried about? So I explore at that time his worries. If he has no worries and he's okay, then I will say normally, like, we now have enough information from your test to give you a clear diagnosis, and then start to give the diagnosis, not like breaking bad news. Yeah, we have investigation
Okay.
and we have diagnosis, we have clear diagnosis, we have plan.
Yes.
Okay, doctor. Okay.
Okay. Thank you, Dr. Maida.
Yeah.
Okay. Dr. Aisha also wrote here in the chat box, it's important always to mention the after side effects of medication, that the benefit we aim more than the side effect. That may happen, and if happen, we can manage it effectively with good follow-up. Exactly. They like too much the follow-up and the care and the appointment. These things they love and they like it too much. Good to mention, we will not let you alone. Yes, in this journey, agree. Advice about groups of same disease. Exactly. So share. Many patients with this disease live near normal life with good compliance and follow-up. Exactly. So always give the bad and reassure back with the follow-up and the care and the team and the experience and the groups. So he will be not scared and he will not feel alone, as Dr. Aisha said. He will feel uh, he's under good hands, monitoring and follow-up. Any comment or suggestion, doubt? So we have repeated the HIV. I think this is the third scenario in 2 weeks. We just do the HIV, but previously was with the TB. But today it's separate HIV alone, but the same concept, most of them. We learned today also that the secretion, it's not the way of transmission, only sexual transmission, as well as the sexual and blood, sharing the needles or some blood contact. Otherwise, no need to be worried. Okay. The other message today, the breaking bad news, not to be worried in the disease, which can be controlled by medication. No need to break bad news. You can just mention it as a disease, which can be controlled soon. Any question before ending the session? Okay, seems satisfied. All. Okay, we wish you a very happy weekend. See you next week, inshallah. Next week will be with short clinical cases, alternatively with the long and communication. Thank you all, Dr. Mahir, a particular thanks, and Dr. Naida, Dr. Aisha, and others attended today. See you, inshallah, next week. Goodbye, and good night. Assalamu alaikum wa rahmatullahi wa barakatuh.
وعليكم السلام.